Today is Wednesday, May 21st, 3 p.m., and this is a meeting of the Pikes Peak area Commission on Aging. Madam Chair, you do have a quorum, and so we are ready to begin.
Great, thank you. I think we know everyone online. We don't have any guests. That phone number is Connie Ryan. Thank you for joining us. 520-647-6768, Connie. And
yes, that's me.
Appreciate everyone who's here virtually, and Kent, who's here in person, besides Melissa and Jody and our fearless IT guy, Jared, who just did a meeting prior to this for social engagement. So I need a motion to amend the agenda. And we have a request to move up the presentation by Aaron. And it would be under number 7. And we want to move it up to the top of the agenda just because she is having to leave early. And we want to make sure we get it in our meeting. So I need a motion to move presentations to the top of the agenda.
I move that we move the presentations to the top of the agenda.
Is there a second?
I will second that.
Okay. Aaron seconding that. So any opposed to moving that presentation to the top of the agenda, please speak.
Just a quick, for sake of the recording, just a quick point of order. We'll move that to immediately after public comments number 4. So effectively, number 7 becomes item number 5, and we will continue with the new item numbers from there. So,
thank you, Jody.
You're welcome.
So I did not hear anybody opposed, so motion carries. Thank you for that. Now, do we have a motion to approve the agenda as amended?
This is Connie Ryan. I will motion to approve.
Connie hit the button first, so Connie's motion. Is there a second?
Second.
Kent Matthews with the second. Any opposed to the amended agenda? Hearing none, agenda is approved as amended. Next, we have consent items, which would be the approval of the minutes from the April 16th meeting. Hopefully everyone had a chance to review those in their packet. And if you did, and is everyone in agreement for the approval of the minutes, I need a motion to approve the minutes as written for the April 16th, 2025 meeting.
I move we approve the minutes as written.
Kent makes a motion to approve the minutes as written. Is there a second?
Phil Stafford here. I would second.
Thank you, Phil. Anyone opposed to not approving the minutes as written? Hearing none, that motion carries. And the minutes are approved for the April 16th meeting as written.
Madam Chair, just a heads up, Penny from Park County has her hand raised. I don't know if it was in relation to that item or something
Thank you. Penny? Is there something we can help you with, or was that just to try to beat the motion?
Penny, I can see you talking, but you're muted.
Penny, can you unmute? Penny 1?
So she's shaking her head no. So Penny, everyone comes in muted. If you have a alert at the top of your Teams window, you can clear that out, but you should be able to hit the mic button to unmute yourself. Nope. Still shaking her head no.
Penny, this is Jody. Are you able to put something in chat for us?
Jody, we'd have to enable it. We don't typically enable
okay.
chats for these
Thank you.
meetings, but I can see what we can do.
Okay.
Welcome, Laura. Thank you for joining us. We are on item number 4, public comments and presentations. Do we have any public comments that have been submitted? Anyone online? No, we will move on to
Oh,
presentations.
sorry, Paula. Could
Oh, yes,
I share a few public comments?
sure.
First, I just wanted to say, and related to what we're about to go into, Christine Burrows from CDHS, she came to Colorado Springs last week on a listening tour about the multi-sector plan on aging, and we had a very well attended, engaged conversation with community leaders from across different industries and different sectors. I've had a lot of good feedback from the people who showed up that they were not possibly previously aware how much this plan could impact the work that they do outside of an aging focused business or government organization or community based organization. And since we had our meeting with Christine, it has just been kind of spreading like wildfire. I've been getting emails from people across the city asking how they can get engaged. So I want to highlight how just what wonderful work Christine is doing, telling the story about the multi-sector plan and how we're getting a lot of good engagement, good momentum in Southern Colorado and the Pikes Peak region for like a good time for cross collaboration and looking at how we can grow projects with people adjacent to aging, what I call my aging adjacent peers. So it was wonderful. And then also today, I'm coming from a summit in Denver with an organization called Aging While Black. And this organization is based in Louisiana. They're operating all over the country, but they're convening communities for summits and listening sessions to understand the needs and opportunities and the community support networks that are available for supporting African American families and elders and communities. And we're hoping eventually to get a conversation like this for Colorado Springs, Southern Colorado, and other parts of the state. And if anyone has ever engaged with this organization before, it is such it's a very well facilitated, age positive, community directed group. I learned a lot today. I learned a lot about how we can engage each other in the community and elevate resources that we have available that are already in community. One thing that they were talking about was instead of building our own collaborations, I know that Dayton and I have talked about this in the past as well. And we don't have to build new collaborations from scratch. Maybe we can see who's collaborating in some areas and build on the energy around what we have in common. Anyway, I would encourage everybody to check out Aging While Black because I think that they're talking about serving aging in a community in a way that is, in a way that's very collaborative and in a way that I think will be really impactful for our communities in Southern Colorado as well.
Great. Thank you, Erin. Does anybody else have public comment before she gets into her presentation? Okay, Erin, it's all yours.
Okay, thank you. So coming off of Christine having been here for the public sector, the multi-sector plan on aging release, I would like to share just and walk through detail of the plan for anyone who has not looked at it yet. And I think that something that is special about Colorado is that we have a commission on aging and at the state level. And something that's special about Colorado is that our CDHS, the Colorado Department of Human Services, they pay somebody to be our senior specialist on aging. Not all states have a senior specialist on aging. Not all states have a multi-sector plan on aging. And even though we don't have necessarily a giant pile of money that comes out of our state government system to serve aging, I think that having the attention of the governor's office, having the attention of CDHS on aging, it makes it possible for us at the grassroots level to pave the way for a better experience for growing up and growing older in Colorado. The work of the multi-sector plan on aging is the culmination of many, 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 many surveys and many conversations, a lot of research with the state demographer's office, a lot of research with universities, talking to businesses in urban and rural and frontier areas. And Colorado is a very diverse state in terms of the opportunities that we have if we live, in the Eastern Plains or the Western Slope, or if we live on the Front Range. And I personally, in the work that I've done across different communities in Colorado, um, I think that this plan is broad enough to capture a really big picture of what we could all use a little bit of support in developing systems around us so that we have a better environment to age in. And also, by opening a draft plan for us right now, what Christine is hoping to get is the details of community. She cannot in her day talk to every person in Colorado and plug in the focus that would make the process of aging easier for them. But they really want everyone's voice as much as possible in this. And so I would encourage everyone to look at the plan online and fill out the feedback form online. So let's walk through it a little bit. So if we can go to the next slide. Let's see, and we'll go to the next slide. And when I presented this last week, when we were speaking in Southern Colorado with leaders outside of an aging specific industry or sector, we did talk a little bit about common language and just ageism and age inclusive language. We talked about changing the narrative, which I know a lot of people are familiar with. But something that I think is still relevant to the work that we do here is the idea of when we're talking about aging, are we talking about the process of aging, or are we talking about older adults? When we talk about older adults, what number are we talking about? And when we think about the multi-sector plan on aging, it's such a high level 10 years, it's a 10-year roadmap for what Colorado should do to build communities here where people can grow older. So this plan should capture people who will be 65 10 years from now. So that is people who are 55 today. So this plan is not focused so much on a number of who is an older adult, but what it will mean to age into an older adult cohort over the next 10 years and into the future. So we're also talking about needs and opportunities, which I don't have to tell this group. We are not looking at only serving aging as if aging is a place where people suffer. It's also opportunities for what can we do to plug in the good things about getting older and what are the positive things about later stages of life and how can we elevate those in Colorado. And then of course them versus us. We don't like to talk about older adults in a way that others them as if we are not all if we're lucky, on a path to being 65, 66, 67 years old someday. Next slide, please. Next slide. Next slide. I went over this a little bit when I did a presentation about aging policy in Colorado before, but just to touch on it again, the three really important pillars for aging policy and aging design for large systems are academia, so having access to research and data. Government is the touch point for designing the environment in places where we can grow up and grow older, including policy and levers for change, such as the Commission on Aging here, and then also business, of course, because business makes they produce the products that we need for the communities that we live in. So next slide, please. Next slide. Next slide. There we are. So the multi-sector plan on aging, it's state-led, cross sectors, a 10-year blueprint for improving developing infrastructure to support older adults. And we have a really well-built Commission on Aging at the state level that brings in a lot of partners across sectors and a commissioner from every congressional district in the state. So we really do have a good, broad overview of the needs and opportunities of aging across Colorado. So the implementation plan now is really getting down into the tactics of what we need to do going forward. And we're looking at lots of these large themes like age-friendly communities, healthcare, economic security, all of these pieces of the built environment that make it possible for us to grow up and grow older. Next slide, please. So what had been happening behind the scenes for a while is Christine was passed the torch when she stepped into her role to continue the good work that had been done at the state level for aging historically, started working on building stakeholder relationships. She also has a close relationship with the goals of the executive branch in the Colorado government. So understanding how we can write a plan for aging that overlaps with the priorities of our government. And released the draft earlier this year. So what we're looking for now is what is missing, what maybe is in this plan that is not actually feasible, and maybe we should think about breaking that task down into smaller pieces, maybe down the road, and then finalizing the plan, and it kicks off in July. So July 1st, the plan goes from being an ideation document to being a working plan for what should we be doing to, design our state so that we have good lives here from birth to death. And it really is a living document. It's the kind of thing where when Christine presented to us last week, she said, we hope that in 3 years, none of these goals are the same, because clearly we would have met all of our goals, and these first rounds of goals will no longer be a problem, and we can move on to newer, better, easier, more accessible changes that are needed in our communities, and we can just keep moving forward. So next slide, please. So the 5 strategic goals, the big overarching goals of this plan, the multi-sector plan on aging, the MPA, are create connected communities that support all Coloradans. So that is really age-friendly communities. Building a Colorado that supports the healthcare needs of all older Coloradans. So that's looking at healthcare, access to healthcare, having the right providers in the community. We certainly don't have enough geriatricians. We don't have enough nurse practitioners. We have areas of healthcare deserts in our rural communities. So how do we get people connected to that? Number 3 is a person-centered service delivery model, and that's really about long-term support services, LTSS, and what can we do to make sure that we have enough services, enough resources, enough senior living facilities to support the population in our state. Number 4 is understanding the economic impact of Colorado's growing adult population. So that is the macro economy. Do we have a workforce that is built for workers from age 60 to 70? Do we have enough age-friendly businesses where older adults who have the resources available to spend in our small business community are able to access products and services that are of interest to them as they grow older here after their retirement? And number 5 is the economic security of all older Coloradans, and that's the microeconomy. So something that has come up under this section is like there's I can never think of the full name of this organization, but it's a coalition around elder financial justice. It comes out of the University of Denver, and it's looking at building a network in the community of protective services to help educate and support older adults to prevent financial fraud, but then also recover after something would happen. So that if the police department, for example, gets a phone call from an older adult who says they've been a victim of fraud, that they know how to support that person in the best way. They're able to connect them to the banks in a way that is supportive and recoverable for them. So I will pause right there for a moment and see if anybody has any questions.
I want to bring up a question that was in our social engagement work group meeting.
Yeah.
And Kathy, I'm going back to the residents in the mobile home park being told that they cannot call for a well check on neighbors in their mobile home park community, that they were told by the manager it has to be called in by a relative, and they can't get involved, and the manager will not get involved. And I have never heard of such a thing. And they are in El Paso County, so it would be the sheriff. I just wanted to know if anybody has heard that before, and if so, where is that stated? Because the person in our group described some pretty sketchy situations with people in that park, and they weren't getting the help. And she even described people who had passed that were found days later because nobody checked on them. I don't know if this is an appropriate question for right now, but I didn't know if anybody would know the answer to that question. I don't know how a manager of a mobile home park could tell people what they can and can't do as far as checking on a neighbor.
I do think that this is part of, I think that these are important things to bring up in terms of feedback to the state about the supports that are needed, because these are, I've never heard this before, but clearly we could, if one person is experiencing this, I know that it's not just one person, that it must be a problem of other individuals in other areas and other communities in Colorado. So I would say to put that in, and I don't know where it goes. Maybe it goes in connected communities. Maybe it goes in healthcare needs. But yeah, I would say that one thing that we potentially need is a resource to support older adults through situations like that. And there will be some communities that have a system set up, and they might be able to easily plug in and develop one other arm of a system that could help with that. And if not, it might be something we need to build from the ground up, and it could take a little bit longer.
Thank you.
Erin, this is Kent. I have a question. So on number
Yeah.
2, where it talks about support the healthcare needs of older Coloradoans, is that also going to be focusing on the expansion and increasing the robustness of palliative care and hospice care?
It should. And I would, I don't have the plan pulled up in front of me right now, and I don't have all the details in my brain, but please do pull up the draft plan online. It's available online. And if that is not in there, be sure to say that.
Okay.
Because I can't imagine that it's not, given the importance of those services all across Colorado. But if it's not, it's something that we should have in there.
Right. Thank you.
Mhm. Anything else right now? Okay, let's keep moving along. Next slide, please. Next slide. Next slide. Next slide. And next. 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 Sorry, guys. Next. 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 There we go. Okay, so when we were together at El Pomar last week with these leaders adjacent to aging, we had a work session where we kind of sat down and we went over it together in detail. So on to the next slide. The questions that really Christine wants to know: what did we miss? How can you help? So you might have something awesome in your neighborhood, or you might know of a really cool project going on at a nursing home that maybe you've never seen anywhere else, or you might have seen maybe at your church a support structure that you think could scale really well across the state. And who do you know who can help? So something that I really value and that I appreciate about the work that Christine does is that, you know, aging services and growing up and growing older in Colorado is not an isolated chunk. It's, what does it mean to serve older adults in Colorado? What does it mean to be an older adult in Colorado? And so who should be at the table who isn't here? Who is someone who's running a really cool project, and by nature of the fact that they've never engaged intentionally with older adults are excluded from their project. How can we call that person in to extend their work so that it reaches into the lives to support the needs and opportunities of older adults? Next slide, please. So if you go to these QR codes, I think that they maybe are no longer functioning, but you can find the multi-sector plan on aging draft online. I know for sure that everybody has received an email that has a link to it, but we can send it out again. So there's the draft, there's the feedback form. We did an activity when we were together last week, that was called What One Thing? And the question that people answered was, what one thing, if changed in this community, would have the greatest impact on the lives of 80-year-olds living here today? So what one thing is the biggest barrier to aging well? And we got answers like, it's the transportation system, it's the housing system, it's the lack of navigators for healthcare between hospital and home. So I like that as a really, just a thought activity to think about, the most urgent issue, the most pressing issue, and the one that if we address will have the greatest impact. These questions here on the right-hand side of the slide, after you read the multi-sector plan online, you can log on to the feedback form, also online, and these are the 6 questions that the state that Christine has put together to understand how they can edit the draft plan to make it more inclusive and to make sure that it's formulated correctly to serve aging locally, at our, all the tables that we sit at home, at work, in our communities. So please think about, this. I mean, I know it's a lot of work, man, and I get super pumped up about policy. And I don't, my girlfriends, when we go out in the evenings, they don't want to talk about transportation systems and how it impacts healthcare access for older adults living in rural communities. It's not always their cup of tea. So it is a long plan. There's a lot in it. It will take some time to go through it. And after you've read it, it really is a simple feedback form, 6 simple questions to answer, or go to town and write a novel, because Christine has gotten some novels too, and we appreciate all of the feedback that we get. Next slide, please. Next slide. So I'm going to share these because I would like for this group to know sort of some of the themes that have come up already, but don't use these as the answer to the test. So don't let these cloud you when you read through the plan. These are some things that we have heard in other areas, but these are certainly not the only things. So what kind of things do you think that we need here? What do we need in Woodland Park? What do we need in Colorado Springs? What do we need in Teller County and Park County? So we've heard about rural initiatives should be addressed more, public safety, federal, the federal funding changes, concerns about timing, agreement around goals and initiatives, lots of excitement about engaging, and that we need champions. We need champions across sectors. We need champions in the weeds, and we need champions, across town. We need people who do not consider themselves to be in the business of serving aging to say, yes, we see you and we know that this is important and we want to support this. So next slide, please. So coming up next, grand launch is July 1st. That's when we hit the ground running. After the final version of the plan launches, there will be a data dashboard available online where you can go and see how we're doing, getting our work done day by day, year by year. So the year one initiatives have already sort of been established because we want to get the ball rolling and we want to embed this plan in local communities as much as we can. Because one of the reasons that we really want to do this now and that we want to get the ball rolling now is because Governor Polis values the multi-sector plan on aging, and he's term limited, so he will not be the next governor. And whoever the next governor is, we're not sure if aging will be a big priority for them. And so, whatever they bring into the office when they come in, we want to sort of ride the wave of support while we have it now to make sure that we can get the ball rolling in local communities. So right now working on getting stuff going. Year two starts in 2026. So from the feedback that we received today, we'll be designing the next steps and the next initiatives for the year 2026. And then of course, stay connected. Pikes Peak Commission on Aging is a great place. Glad you're all here. The Colorado Center for Aging is the nonprofit that works specifically on policy across Colorado, and then the Colorado Commission on Aging, which is where Christine serves her time to get the plan out to local communities. Next slide. All right, thank you guys so much. I love coming to groups. I was just saying it today. When I was in Denver, there are a lot of conversations that I have where I feel like I have to spend a lot of time um, setting the foundation for the fact that aging is important and it's valuable as a system, and it's something that we should think about. And it's great to come here and share with everybody who's already given their time and their expertise to making aging better in the Pikes Peak region. So I'm excited to share a little bit more detail with you all. And I'm happy to have a conversation if anybody has any questions. We're still collecting information and feedback from community members until the last day in May, what is that, the 30th or the 31st? 31st? Got to do my little poem in my head. But yeah, let us know. Let us know what's missing. I think that this group in particular will have a really good lens on what is possible.
Great, Erin. Thank you so much. That was very informative. Does anybody have any questions for Erin?
Madam Chair, this is Jody. I just want to remind everyone that we will be doing our own little public session tomorrow after our Regional Advisory Council. So aiming for right about noon. Lunch will be provided if you're nearby and want to stop by and provide some input. And we'll have kind of a guided conversation so that we can gather your thoughts and input and put that in. And of course, if you're not able to join us, this is a public process, and so you are welcome to review that and provide answers to those 6 questions. If you need a copy of that, just reach out to Melissa. She can get you that link for the responses. Thanks so much, Aaron, for condensing this for us, and safe travels.
Yes, thank you.
And Erin, is there a way you can share that PowerPoint with us, those slides with us?
Yes, yeah, I will do that. I'll send it out to Melissa. Is it okay if I send it to you and you can forward it on to everybody?
And since you already sent it, I can just forward it.
Oh yeah, true story. You do have it.
Yeah,
Yes, please.
we
Yeah,
had
just forward it right along.
we had quite the busy day today, but yeah, so I'll forward it on.
Thank you so much.
Yes, thank you.
This is
All
Connie.
right.
Erin, I would just like to say your passion for all of this is incredibly contagious and motivating. So thank you for everything you're doing.
Thank you. I really appreciate that. And I have come to recognize that not everybody is excited about transportation policy. And I, for some reason, have found a wonderful little group of people, or a growing group of people here in Southern Colorado who are also, doing the good work. And so I appreciate that, Penny. Thank you so much.
Okay. Moving on to action items.
We have no action items this time.
Okay. Erin, you're back up with the membership committee update.
Oh, wonderful. So I presented as the appointee, as a municipality appointee from the city of Colorado Springs. I presented to the Colorado Springs City Council last week also on just the structure and the framework of the Commission on Aging, and just really an introduction of, hello, I'm Erin, I'm the nominee. I'm the appointee from the municipality, from the city. We have a lot of new city council members, and after I presented, I received some messages from some of the new members and from some of the members who'd been on the city council for a while, just wanting to engage more about how they can, become better acquainted with the commission. And I just love that. It was wonderful. One of our city council members even showed up to online, unprompted, to the Colorado Commission on Aging meeting that same week, because she said, I want to learn more about this and what I can do as a city council member. So I'm really excited about that opportunity and what we can do to help engage our elected officials in our local regions. So looking forward to debriefing with Melissa a little bit about how we can frame our presentations to other municipalities from the PPACG. And so that's the biggest message from the membership committee this month. I don't believe that we have anyone new coming on right now. Still waiting to hear back from Teller County, and one person who's interested in being appointed, but is also kind of an employee. And so looking at her funding and how that would work if she uses some of her paid time in service to the community in this way. So I'm excited for other presentations about the Commission on Aging going forward.
Yeah, great. We sparked some interest with our presentation to the PPACG board. Kathy and I presented the Wednesday, just a week ago, to that board, and we sparked some interest in specific questions as to what areas of the jurisdiction that we do not have representation from, and I think we're going to get some response, if we haven't already, from those areas of El Paso County and beyond that we are in need of representation. So I think that was well received also by the PPACG board.
That's great.
Yeah.
And I know that Andy Gunning, the executive director of the PPACG, values our work on the commission and that he really values having communities where aging is part of the conversation and part of the design and the built environment and policy and everything. And so he is, I believe, onboarding. Don't we have some new commissioners on the PPACG soon?
We have
Or
three new
maybe
city
have
council.
just been appointed?
Yeah, three city council members have just been appointed in their new terms. So he'll be visiting with them, and this is part of the conversation that we do. So.
Yeah, and it's great. I mean, I think even the fact that we have a commission on aging in our area council of governments, it's not, I mean, there isn't one everywhere. And I think it demonstrates that we have a good interest and community engagement around aging and older adult issues here.
Erin, this is Melissa, and I just wonder, speaking of Colorado Springs City Council, do you remember who the city council person was that joined the Commission on Aging meeting last week? Or whenever
Yes,
it was?
it was Kimberly Gold.
I was
Councilmember
wondering.
Gold.
Yeah, I'm so glad to
Mhm.
hear that. I was kind of curious if she was going to be the one. So great. Thank
Yeah,
you.
yeah, it was incredibly supportive of Colorado Springs and incredibly supportive of the work that we're doing. And I didn't even know she was coming. Her name just popped up on the Zoom call, so I was grateful to see her there.
All right. Next, we have updates on community outreach. Melissa, do you have updates? Or does anybody have updates on anything they might have done since our last meeting? I know there was the Silver Key Expo at a Great Wolf Lodge, and PPACG had a table. So
Melissa, can you field that? I did set up, but I couldn't be there the day of. So
Do I need to go back to that day? Wow. So Silver Keys event at Great Wolf Lodge was phenomenal. We had 4 people at any given time at the table there. Kathy volunteered some time. We also had our rack chair there. And there were times that there were 5 people deep coming off of our table. We were in a great location, really good information. I think, all in all, I'm sure hopefully Silver Key was really pleased with how it all went. So we did not get a lot of interest in joining the RAC or the Commission on Aging, but did talk to a lot of people about a lot of very personal circumstances, as you can imagine and expect. Everyone had, really detailed experiences that they wanted help and guidance on, whether it was for themselves or a friend or a loved one. It was a great event. And I'm grateful that Jody did set up the night before. So, yeah, that was good. And honestly, I don't have in front of me right now if we have any other outreach events scheduled for June and July. So you'll just have to bear with me on that.
June is Sports Corps Senior Games, June 6th, 7th, and 8th. So if you are looking for a volunteer opportunity for that weekend, you connect with Melissa. I think that's all we've got for June. Yeah.
And I did send an email out to folks, and people did express some interest in kind of joining in on that day, doing something. So whether it was a formal, volunteering piece or just planning on going and checking it out. So I do have that. And I do have a few T-shirts ordered for a handful of folks. So those will be on their way. And yeah.
So going back to the Silver Key event, thank you for setting up early, Jody, because on the morning of, Channel 11 was doing live for their morning news segment from the lodge, and they interviewed Jason 2 different times. And on the second time, they interviewed Jason, the reporter, as well as Jason, the PPACG, the long table was in the back. So the PPAAA table was in the background with the big logo and everything else. So thank you. We got some free exposure on TV because of that. So thanks.
Oh, that's great. Thank you for letting us know. We'll take it, right, Jared? We'll take anything like that. That's wonderful. Thank you.
All right, we'll move on to the Policy Committee and the Colorado Center for Aging report.
So the legislative session has kind of come to a close, and Colorado Center for Aging is closing up their kind of spreadsheet of what was tracked this year and what was passed, what was not. And so I'm looking forward to seeing that come out and sharing it with everybody in preparation for thinking about next year. I also know that Erin is, I think, the vice chair of that group. So I don't know, Erin, if you want to add anything else.
No, I think that that's good. Sort of, we shift into a different mode after the legislative session ends. So looking at growing our membership and reflecting on what we achieved this session and what we can get going for next year.
Okay, great. Next, we will have the PPACG Legislative Committee report. And here comes Jared to the podium.
Good afternoon, everyone. I've included in the packet, I'm not going to pull it up here, but it's just basically the status of where we ended up on the state legislative side. Among the bills we opposed, the bills we supported, bills we were to amend or to monitor position, and where that ultimately ended up. Has it been signed by the governor? Is it still awaiting a decision by the governor? Was it postponed indefinitely, or was it just lost on the calendar? Happy to answer any questions. I will say, regarding state, we are expecting, although it's not official, a special session focused on the budget. That is largely dependent on what happens at the federal side, although secondarily probably tied a little bit to what we expect the June revenue forecast to look like, which I believe is supposed to come out on June 19th. So I think either of those two factors could cause a special session to be called. On the federal side, we are tracking the developments on the federal side, at least as it applies to aging funding. We're encouraged by what we're seeing so far. All the focus has been on other areas that doesn't directly impact us, although it could impact our workload in the long term. But that is the House's speaker still planning to get that through the House by Monday. We'll see. The House Rules Committee wrapped up about 12-hour committee or 13-hour committee work group about noon today, noon Mountain Time, I should say. So yeah, no, it's a fun time to be a policy wonk. So.
Right. Any questions for Jared? All right.
Yeah.
Thanks, Jared.
Oh, yeah. And Madam Chair, I will point out, just as a reminder, I know it's early, but since we've just come off the legislative season, we will be watching for opportunities, especially as legislation already, whether it's through the special session or moving into the new legislative season in January. We do anticipate the Senior Caucus on Aging to happen each month, January through April. And so as we get closer to that and topics are determined and that kind of thing, and opportunities possibly even for going to testify, we will make sure that commission members are made aware of that. I would also like to just invite anyone who may be interested in attending those or possibly learning how to testify before any of the committees during the legislative season, to reach out to me, and I'd be very happy to coach that process. It really is quite simple, and in most cases, you only have 2 to 3 minutes. So it's not it really isn't a heavy lift. They've made it far easier than in the past. Another one of those silver linings from COVID that they made testifying before a committee available through the Zoom system. And so, whether it's that or in person, I would be very happy to coach that process and sit alongside anyone that would like to accompany me for those opportunities. So, testifying aside, like I said, once the planners have sorted out the legislative caucus on aging, dates and times and that kind of thing, we'll be sharing that out with the full commission. And so if you'd like to join us, we'd love to have you. And I know Kent got to go with us one day. This past session, I think either the February or March date, and listen to the speakers. And so we'd just love to have you. So I want to make sure that you are really become comfortable with the process. It can be a little bit intimidating, but once you get in there once or twice, it's quite simple and an easy process to be part of. So we'd encourage that. Thanks so much, Madam Chair.
Thank you, Jody. All right. The Colorado Commission on Aging, I know they meet after we meet, but is there anything to report from last month's meeting?
Hi, Paula. I
Hi, Penny.
will just do a summary of the meeting in Colorado Springs to explore and gain insights from the business adjacent people that Aaron was speaking of just earlier, coincided with the Commission on Aging. So my notes will not be representative of the entire session. I needed to leave early. But I think there are three things that are important to be aware of. That, like El Paso County and the Pikes Peak region, the state is watching very carefully what's happening at the national level legislatively. And from the lobbyist for the state, one word seemed to sum it up, and I think we all can resonate with that, was uncertainty. So the good news was it wasn't panicked uncertainty, but there are a lot of balls in the air, and there's not really a high level of confidence. It doesn't seem at this point as to where those balls are going to land. Certainly Medicaid funding, what will happen to the SNAP program, some of the CMS staffing regulations, that all of these impact older adults. And we will see. So uncertainty is the word of the day. The other thing I think it's important for us to be aware of is Jody has often kept us updated on the status of the Older Americans Act. At this time, and Jody, please correct me if there's something new since last Thursday, it has not been authorized yet, which is probably not a good thing, but funding continues to be as it has been in the past. So it's, again, uncertain, but it's not panic. Any thoughts on that, Jody?
Thank you, Penny. That's correct. The Older Americans Act has not been reauthorized, but because it is still in statute at the federal level, the work continues and the funding is still slowing. We have not seen a slowdown or a stop in funding, much like you may be hearing on the news with some other federal departments. And so we're very grateful for that and quite fortunate at this range. Uncertainty is the new COVID pivot word, right? So we're operating right now with as normal, which is really important to make sure that we are continuing to serve our clients, whether that's directly here with the services that we do from the AAA offices or the many services across all three counties by our subcontractors. So we continue to do that. To Penny's point, we do anticipate funding to be flat. In any other year, that would be something that we'd be really disappointed in. I would say, given the level of uncertainty that we're experiencing, we will take flat funding. We can work with that. And so it's going to be quite a process yet because we're in the midst of contracting with the state as well as contracting with our providers. But we do anticipate ultimately being right-sized to flat funding from the previous federal fiscal year. So despite the challenges, despite the uncertainty, the good work continues, and that's what we'll continue to do until we're told otherwise. So thank you for that update, Penny.
One other thing, the third point that resonated with me, and I think it's important for all of us on the commission, and I certainly think those conversations that will extend to people from other municipalities, perhaps, that are interested in joining. And I think that you really focused the center, Jody, on the services that continue to be provided, the variety of services. And certainly we have a representation of the variety of services on our local Pikes Peak Commission. And one of the things that came out from the representatives, many representatives from the state that attended the American Society on Aging, is that as people that are active in the service, whether it's as a volunteer, a paid community provider, that we become really much more astute about communicating the business case, why the need is there, how the services meet the need, and the return on investment of those services. Because I'm thinking, just in the work that I've done and having been a member of this community for my entire life, ours is a community that values volunteer, the do good things, the people support their community. That's absolutely true. It's not going to stop. But even if it is volunteer services, certainly if it is a reimbursed service, I think we must be prepared to identify the value, first of all, the need, the specific services, and the value of those services. Could be a monetary return on investment, could be a social return on investment, but I think we have an opportunity to really actively build awareness and take advantage of this time of uncertainty where people are questioning. Perhaps they will be more open to listening during this time than they might be otherwise. So we will continue to keep updated from what's going on at the state and link it to what's going on in our community. Thanks.
Thank you, Penny. Jody, next is the PPACG Board of Directors item.
Thank you, Madam Chair. Really just wanted to point out last week's PPACG board item was around Paula and Kathy sharing updates around the Pikes Peak Commission on Aging, and also wanted to say another big thank you to Melissa in her role as liaison with the committee and the work that she did working with you all and getting things prepped and ready to go. And so Paula and Kathy, I just want to thank you for taking the time out of your busy schedules and being able to participate and provide that presentation. I think ultimately it is really important for the board of directors to especially with some new members, that they're able to hear about the work that's going on. And I'm really pleased to hear some of the questions, the calls, the emails that have come out since both the meeting, both of the presentations so far, both at City Council and then last week's PPACG Board of Directors meeting. As has already been presented, big focus, of course, all the way through the spring is the legislative work that's being done with the Pikes Peak Area Council of Governments legislative subcommittee that's made up of a variety of a board of directors providing input with our senior lobbyists. We do also want to share, and I think I might have shared this in the past, but just in case I haven't, along with our state legislative lobby group, excuse me, we now have a federal lobbyist. And so we can stay further connected with our federal legislators as well. So that's all I have to share at this time, Madam Chair. Thank you.
Great. Thanks, Jody. And I just have one last comment on that presentation. Dayton gave us a really solid template of a foundation of a presentation that we used last year that we just kind of updated and added a few things to. So I want to thank Dayton for giving us the foundation of that presentation that we will, I think, just continue to add and edit. But Dayton, that was all your work to piggyback on. So thank you for everything you did last year to make that presentation what it is. So thanks. All right, next is working session updates. And we'll start with the Accessible and Affordable Healthcare Digital Access group.
Aaron, did you want to lead us off, or would you like me to kick us off?
Erin may have stepped off, Dayton. She had
Okay.
Yep, so thank you.
Got it. Yeah, no, sure. So a couple of things, couple of updates from the last time we'd met. One sort of headliner is that the Digital Equity Act grant was terminated. The Colorado Department of Labor and Employment Office and the Future of Work received notification on May 9th that federal funding for the State Digital Equity Capacity Grant has been terminated effective immediately. The funding's original end date was December 31st, 2029. There's more information on the state's website to kind of talk a little bit more about some of the uncertainty and some of the impact this has on the many months of planning going into this, and just kind of being in the world firsthand. I could say a lot of creativity is being prompted of how to fund some of the extraordinary projects that were being proposed to tap into these capacity funds. Colorado, as you know, was pretty unique in forming coalitions across the state and utilizing some of those resources to bring people together to address some of the digital divide that we see. So with all that said, Aaron and I took a first attempt at putting together a draft charter for this working group, and just kind of high level, and I'll share that with you, Melissa, which you could share with the rest of the commissioners, and we could redline it as much as we see fit. But just kind of the high level part of it is, I think there's like an underpinning where we're looking at digital access as a super social determinant of health. I know y'all have heard me say that in the past, but the key part of helping people gain access to digital literacy, suitable internet speeds, and hardware is just recognizing that those three things are essential and influence everything from healthcare access and social connection to economic opportunity and overall independence. So as you review our draft charter for this working group, you'll notice that a great amount of it does call out the Colorado Digital Access Plan, really using that as a North Star to align with, and also leaning on the work group as a strategic advisory body to help ensure that older adults in our region have reliable internet access, appropriate devices, and digital literacy skills needed to thrive in today's increasingly connected world. So there are some high-level strategies in addition to some key tactics. And those key tactics cascade into things like developing educational toolkits and resources, advising our group in addition to others on opportunities related to digital opportunities and access, ensuring that we remain representative of the needs of older adults as it relates to the digital divide, and also supporting the identification of any connections we can make or coalition building. Something that Aaron had said a little bit earlier that has really resonated is leveraging existing groups' efforts and energies, because we, especially in our region, have just extraordinary people sitting around tables with just extraordinary efforts. And so how to really dovetail or align with some of those efforts and look through the lens in which we can use technology to amplify some of those efforts and those types of things. So you'll notice a good amount of those details in the charter as it's shared, and there are some housekeeping items in terms of how regularly our group will meet, some of our recruitment methodology, decision making, as well as just our overall report out to this group to both gain feedback as well as keeping everyone kind of apprised and on the same page as we all work together in our different work groups. And that's all I have for now. Thanks.
Thanks, Dayton. Melissa, did you have something to add?
For all the work groups, I'm just going to double check if you did set up a recurring meeting time and date so that we can have those available and posting. So did you guys have that, Dayton? Did you guys agree on anything?
We agreed meeting monthly, Melissa, but we haven't agreed on the kind of the day that falls on or the time yet.
Okay, thanks.
Thank you, Dayton. The next work group report is the age-friendly housing and transportation. Were you guys able to meet? And if so, do we have a report? If not, we'll move on. All right. It was just whispered that maybe Steve and Phil met so long ago that maybe they forgot they met. Is it jogging a memory or two? Steve or Phil? Hello? Okay, we'll move on. We'll move on to the caregiver.
Hey there,
support.
sorry about that.
Oh,
I
that's
was
okay.
I was struggling with my mic.
That's okay.
Steve and I did meet, and we had a great meeting, and had some good collaboration and thoughts. In general, we put it off until after the whole legislation session and such, and thought that we would get a better audience shortly, probably in the June and July timeframe. And we will meet again and probably have a little bit better report next month, or maybe more of July timeframe.
Okay, great. Thanks, Phil. Did you guys set regular meetings?
We did not,
Okay.
but we will. I went to his office, and we are both West Siders and talked a little bit more outside of the scope of this, but also had a pretty good collaborative effort of what we can do, common goals, and thought that June and July would be a better time to get this thing going. So we will meet again shortly and have a better report next time.
All right, great. Thanks, Phil.
Uh-huh.
Next is the caregiver work group. And Connie, I think, were you going to report out on that?
I can. I'm driving right now, so let me just pull over. But we did set a recurring meeting the third Thursday at 4:30, I believe. But we did have a really good, productive meeting. So I don't know if Wanda or Penny want to actually give the summary, since, oh my God,
Yeah,
there's horrible traffic.
I have my voice back, so yes, I can do it.
Great.
We came up with an outline, and we talked about a mission statement, and we defined the needs, agreeing to the monthly meeting and the date and the time. And we talked about Lake George and having like meet and greets and bringing more people into the conversation, especially caregivers. One that I recognize in my board is Sheila. She is huge on the caregiving thing, so I'm going to invite her over to give her little moment and talk to us about what it's like. And let's see here. That's about it for right now.
I think I'd like to add that we all were pretty much on the same page as far as what the needs for this group need to be, and addressing the community's focus, as well as the well-being of the caregivers, and then tying in some sort of legislative action with that. So we've started putting together some quantitative goals, a charter. We have a draft of that, and I don't know, it was a very efficient meeting, and it was great how we were all very much on the same page with things. So I think there's a lot we can do here. And then so we'll meet just as our internal group next meeting in June. And then from there, we'll start looking as to who we need to recruit in the community so that we're accessing right people. Oh yeah, that's it. We want to work with Lucy Calhill with the AAA now, and work with people who have a pulse on the caregivers in our community to start pulling the needs and that information from there. So, yeah.
Great, thank you. And finally, the social engagement work group, which is fresh off the press because we just met at 2 right before this meeting. And Wanda was going to report out to the commission from that group.
I'm finding all my notes here. We did discuss, we're fine-tuning our mission statement. We did discuss a lot of our purpose in the group. We as well were kind of all on the same page as what that would look like. We did hear about some concerns, I guess you could say, of folks that we know that it sounds like isolation's a big thing. So we've kind of discussed a little bit of that. I have notes all over my desk, and I'm I'm looking for the social engagement one. But we did set up times for meeting next. And we did agree that we could benefit from probably meeting a little bit more than once a month, just to kind of get things streamlined and structured. I don't know, is there anything more we can add?
Kathy, do you have anything else to add? We did set a regular meeting time and date. That was every other Friday at 12:30 virtually. So we were supposed to meet last Friday, so our next meeting will be the 30th. And then every other week from then on until we figure we don't need to meet. We did hash out a mission statement that we're all going to massage and discuss at our next meeting. And some of the ideas that were talked about, we had a person, a non-commissioned person in the group, and she had lots of comments about social isolation from a personal experience and from the community where she lives, which is that mobile home park community that I had the question about earlier. We talked about maybe developing something tactile, like on paper, that lists out actual events and outings and groups where people can go to get out of their home or apartment and get into some kind of an engagement. So like an index of social engagement, like an social engagement calendar kind of index that, when you ask someone, hey, do you want to go do something? And it's just kind of a nebulous question, but instead having something like, hey, there's a concert in the park, let's go, instead of giving them a no, a chance and the opportunity just to say no, actually have something that you can say is happening and you'd love to pick them up at this time. So kind of having an index of calendar of events that could possibly be posted, maybe even having a meetup group. The one our dean, who was a part of our meeting, said, she knows ladies that will not go into a restaurant by themselves to eat by themselves. So talked about maybe even having a social meetup group, which, would be, we would make there would be a reservation made at a restaurant. It could be Dutch. Everyone would go Dutch, but it would be a planned, third Wednesday of the month, the social meetup group would meet, and that would be a planned outing where they could go knowing that they were going to be in 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 some kind of a community connection engagement with other people that were also looking for some kind of connection or engagement with others. So we came up with some other ideas, and so we had a good brainstorming session for our first one, and Kathy led it well. So anything else? I don't think so. Okay. Moving on to discussion items. Jurisdiction presentations.
I'll go ahead and kick it off a little bit. So again, we've been doing a lot of work on this, from having kind of pre-planning meetings, working to bring together both the Commission on Aging appointees as well as the Regional Advisory Council appointees, and, spending time discussing what the messaging should be and how that should look. And so we're going to continue doing some of that. Of course, we did have Erin actually present to the Colorado Springs City Council last Monday. And so she's not here right now, but some of us were in the room. We might kind of circle back and comment on that a little bit more. She shared some things at the beginning. What is still kind of out there is working to set up an opportunity with El Paso County Commissioners to have our 3 appointees present to the El Paso County Commissioners, the Park County Commissioners with Penny Everest from the Commission on Aging, as well as Sheila from the RAC. And then we have Laura Cronick from the Town of Monument on the RAC. She's a city council member herself. And then we also have Gordon Rick on the Regional Advisory Council, who is a city council person with the Town of Fountain. So we have a lot of opportunity and diversity kind of running across this jurisdiction presentation conversation. So appreciate everyone who has put input into this so far, and just kind of looking forward to trying to make it happen. We were originally thinking of trying to present on a quarterly basis, but we are moving that down to a twice a year basis. And so the idea was we could try to squeak something out in May for Older Americans Month, which we did with the city of Colorado Springs, but that is probably not going to happen with our other jurisdictions. So we'll just kind of stay tuned on that and try to make it happen in June. And then the next presentation we were talking about happening sometime in September to kind of tie in with ideas that would coincide with potentially state legislative themes that might come up, to just be sharing that with the jurisdiction. So stay tuned to more of that. That's kind of the overall kind of foundation of it. And with that, I'm going to kind of open it up for other people to comment, ask questions, share. And again, just really appreciative of all the people who have been in on meetings so far, offering their input and trying to share information. I know Steve texted me a little bit ago, emailed me, said that he was having microphone issues. That's why we didn't hear from him earlier. So if he might be able to jump on now or not, but I will turn this over to other folks who might want to comment about the jurisdiction presentation process or ask questions.
I think it would be nice to have all of the commissioners take part in a presentation or two, and specifically maybe in the community where they are comfortable or live, like Phil is in Manitou West Side area and Steve obviously is too, but maybe have commissioners present kind of in the area where they live because they represent that area, whether they represent that area on the commission or not. I think that might be good, and then that would have everyone well versed on what we do. I don't know. That's just my thought.
The mic is going goofy. I would be willing to support whatever you would do in eastern Colorado, like in the Calhan area. I think that sometimes is an area maybe we don't acknowledge as much as we should, and I'd be happy to be involved in that.
Thank you, Penny. That is definitely one of our PPACG jurisdictions, so it would be on the list for certain. And for those of you who may be concerned or worried or nervous about doing this type of presentation, I have to share really the beauty of going before the jurisdictions. First of all, the jurisdictions are already represented within PPACG. They see a lot of the all of the updates for the board meetings, and so you're going to have at least one champion with you in that room behind the dice. So aside from that, I'm going to be attempting to be at every single one in case a question comes up. that you might not be able to answer or comfortable answering, because as we saw at the city council meeting, some of the questions were not directly related to Aaron's presentation, but were aging related. And so, I was able to stand up and introduce myself and answer some questions. So we'll be doing that as a way to support you all. We're not asking you to go out there and do this solo and wing it. When we went to city council last week, there were, I think, what, 5 of us. It was Aaron and myself, Melissa, Paula, Dayton, and so you have friends behind you. So as we get around to all the jurisdictions, just know that it's a priority for us to make sure that we have staff with you to accompany you in case there are questions that you're not sure about.
Here's another thought. So you would think I would remember, but I'm having difficulty. I know that in the fall, I'm thinking it's maybe October, is usually like National Caregiver Month. So a thought is to try to have small presentations to the different jurisdictions that we cover around that time on caregiving or care partnering, whatever we want to call it. But that might be another easy, I don't mean easy, but it might be a different way to begin to raise that awareness.
This is Connie. Kent, I personally really like that idea. Can you email it to us in regards to that caregiver work group, and we can add it
Sure.
to our discussion items? Thank you.
Sure. Yep.
Penny,
Hi,
I see
this
your
is
hand up, and then Dayton, your hand up.
Yes, I actually was on the meeting that you guys did to the city council, and I learned a lot from watching everything going on. I learned a lot from Erin, watching her mannerisms and speaking. I'm the type of person that'll throw up just before I start speaking, so I get really nervous. So just so you know up. So Jody, I watched what you did. That was great that you came up right behind her and covered her. That was wonderful. So learning a lot, and I'm almost ready to give mine. I just have some squeaking, just a little bit of squeaks to put in to the information, and that's about it. I'm close.
Oh, that's awesome. Yeah, we'll make sure we've got staff to be there with you. No problem. Dayton, I see your hand up.
Yeah. So I love this conversation. I just wholeheartedly want to agree with Ken in terms of being strategic in speaking opportunities and presentations. I know right now we're kind of talking about jurisdiction presentations, but I see there being other opportunities, and just kind of dovetailing on top of opportunities that are making those topics salient and kind of at the forefront, and we could just be a reinforcer or a catalyzer during those. And for what it's worth, in our charter, for our work group, we did mention that we will aim to at least present during one local conference or a state conference, something like that. And I think that kind of goes hand in hand with the identification of those opportunities from us as a work group. So just kind of throwing that out there as an idea. And then lastly, I just want to raise my hand to help out with any presentations as well. I'm a big, I'm a fan of PowerPoint and kind of flow and putting together something really cohesive to resonate with audiences and everything like that. So I think the more we could kind of speak the same language on a foundation setting piece in our presentation of saying, here's who we are, this is what we aim to do, and these are our aim takeaways in this presentation to kick off our presentation, and then tailor it to our audience, I think is going to be a really important flow structure of our presentations. And just want to raise my hand to say that I would be happy to also contribute to those as we put them together and refine over time. Thanks.
Thanks for offering that support, Jody. I mean, Dayton, that's huge. I'm sorry, they just put Jody's face on the screen. So I just say what I see. Really appreciate your support in that, because you are really good at what you create on PowerPoint. Is there any other comments?
I just wanted to
Oh,
thank everybody
yeah.
this is Phil, wanted to thank everybody for a great meeting. I do need to jump off now and jump on a different meeting, but thanks everybody, and we will talk soon.
Thanks, Phil. Okay. Next, we have member entity announcements. Does anybody have any announcements for the group? No? Me? So I guess everyone, hopefully people have Monday off and we'll have time to spend with family or eat a hamburger or hot dog with someone. So Kent's got it off. He's retired. He's being smart over here. So our next meeting is scheduled for June 18th at 3 p.m. And our executive meeting, again, is always open to everyone to attend virtually. We meet the first Wednesday of each month at 9 a.m. And the policy meetings are the schedule is at the end of our packet, and we're welcome to sit in on any of the PPACG meetings, and their schedule is also included. So I don't know, Jared, did you see that little funny I sent you in the email? I found this and thought we could end our meeting with this little funny I found. I don't know if anybody else has seen that, but it's kind of funny. And if you see that guy's hat, it says, "Get off my lawn." I thought maybe we could incorporate some of that into the flag we're talking about having for the aging population. I thought it was
Get a
great.
copy of that?
Yes, I'll send it to
I'd love it.
Melissa so she can include it. She can include it in our. Actually, we should pose that. We should recreate that, and that could be our commission like signature line. Sorry.
I love it.
Anyway, I just thought I'd close with that, and if we don't have anything else, we can adjourn.